Thank you. So now, Manoj, I think we can get going. People can keep joining. What do you say, Robinder ji?
Yes, please. Absolutely, yes.
Robinder, can we go on with it? Then I'll invite Manoj kindly.
Yes, shall we proceed?
Yeah,
Yes,
I
sir.
think we should.
Yeah, sure. Yeah. Hello, everyone.
Hello.
As the world is fighting against COVID-19, it's a very stressful situation which no country or a person should ever experience in his life. And as on date, there are so many questions that are in our mind, but what exactly is needed is the correct and the factual information and its treatment rather than the common WhatsApp messages or the forwards that we get. So here we have our session with the doctors who will share their experiences with us against their fight with COVID-19. And we would love to have it in a very interactive way, putting up a lot of questions and answers and clearing the various doubts that we have in our mind. Let me first of all welcome our panelists for today, Josephite Ajiguel. He is president of SJA Alumni Association. This is the Old Boys Association of Academy.
Thank you.
Let me welcome Josephite Robinder Sachdev. He is the president of Image India Institute and a Josephite of 1982 batch. I also extend a warm welcome to Dr. Samar Mehta, Doctor of Medicine, both certified in emergency medicine, internal medicine, and infectious diseases, currently practicing in Boston, and Dr. Khushboo Chokshi, Doctor of Medicine, both certified in internal medicine, pulmonary, and critical care, currently practicing in Atlanta. So without wasting much time, I just invite a warm welcome to each and every person in this session. And I would request Josephite Robinder Sachdev to please take over further proceedings.
Thank you so much, Manoj. A pleasure to have. Pleasure, or it's a need to have, but any which way that we all put this together, we are all in it together. It's a storm. May I invite Ajay Goel, the president of the SJA Alumni Association, to give his opening and welcome remarks. Ajay, please.
Thank you, Robinder. So once again, a very good evening from India to Dr. Khushboo Chokshi and Dr. Samar Mehta, though we've been speaking to them, but I formally welcome them to this session. I'm sure it's going to turn out a very good session for each one of us. And I also welcome you, Josephite Robinder, for arranging all this and being here with us. Welcome. I also welcome all the participants, all Josephites, all known Josephites who are there on this session on behalf of the SJA Alumni Association. It's a privilege that I take. We will not take much time because we must get on to the topic. So I would request our moderator for the day, Mr. Robinder, to kindly take over from here so that we can get the session rolling. Thank you, Robinder.
Thank you so much, Ajay. May I now invite, see, we are, as Ajay mentioned, and everybody is looking forward. I think the value would be Q&A, interactive clarification, specific problems, right? But in order for us to kind of, launch into that, probably opening remarks by Dr. Khushboo Chokshi and Dr. Samar Mehta, you can take few minutes, 5 minutes, 7 minutes, whichever way you think, and whatever you may want to share from your, accumulated wisdom, the ups and downs that you've seen, and what are some fallacies that you've seen, some lessons learned, lessons unlearned, etc., whichsoever you may want to share in these times. And as we were mentioning, that the folks out here are probably, some of them are caregivers to somebody in the immediate or wider families, or volunteers, or maybe having no symptoms but themselves also worried. Everyone is worried in a sense. So we very much look forward to your contribution of your time and your expertise, Dr. Khushboo and Dr. Samar. We are extremely thankful for your initiative, and we look forward to an interactive, engaging discussion. May I invite Dr. Chokshi for your opening thoughts and comments, please.
Absolutely. Hi, everyone. It's a pleasure to be here. We've been looking forward to this conversation. I want you all to know that we are all with you do not feel that you're alone. We are trying to help from the US because that is what we got when we were here earlier last year, when we were going through our 3 phases in the United States. You know, I have extended family that is in India. I was just telling our group, our panelists earlier, and, you know, we wanted to really, Samar and I both really wanted to kind of reach out to our family, give them help, and kind of just kind of information that we were able to collect here in the United States. I think the doctors, the frontline staff in India is doing a phenomenal job of trying to control this as best as they can. And I want them to know that we're here to essentially assist them in whatever way that we may be able to. You know, may it be just our experience that we've had here, absolutely, you know, just kind of being there for them, essentially, for the family, the caregivers, and also just the physicians, everyone. I think this fight is all of ours, and I think only if we all band together are we going to get over this. So, you know, as I said, I've been, you know, we started off our year in Atlanta, at least, and Samar will give you his side of it. Was last March, I believe, is when all of this came to the United States. And I remember our first patient when they came here to our hospital was in fact an elderly Indian gentleman, was our first COVID patient here. And at that point, we literally had like few facts that we had to go by. We didn't even know which patients truly, you know, what symptoms to look for, you know, what medications were out there, what could we give. So we've kind of come a long way in that sense. You know, we've collected a lot of data, and Samar and I will go into that based on the questions that you guys have. But, you know, what I essentially want to tell you is that all of you guys, you know, I think there's a lot of fear. And I think once we kind of put in the facts, the fear will subside and we can kind of move forward in a more methodical way, essentially. So that's what we're here for, is to sort of answer your questions. You know, what is it that you want to know, truly want to know? And if we have experienced it, we are happy to share that with you. If there's, you know, if there are questions about certain medications, whatever it may be, we're here to help. I think that, you know, Samar and I both have seen the Indian doctors, their work really, really hard. And I think that they're doing everything they can, and we're here to support them as well. So essentially, you know, whatever it is that you guys want to ask us, that we would open this conversation up, and I'm happy to take it anywhere you like. Only thing that I would let you know is that the opinions that we share are going to be our opinions. It is our experience. It may be drawn from, you know, National Institute of Health, will be drawn from World Health Organization, also from the guidance that the Indian community is providing. But this is essentially, you know, advice, and this is just sort of, you know, letting you know how we did what we did. And obviously, if you have questions that are specific to medications and things like that, that the doctors on ground are the real doctors that you need to be going to. So we're here to provide assistance, advice, but please know that all of this is just in that role. I'll let Samar sort of take on from here.
Thank you.
Thank you so much, Dr. Khushboo. And you highlighted quite a few very pertinent facts that, you know, perhaps the more we are equipped with facts, some of the fear can go down. And if there's a methodology, you know, which mitigates that fear, that's one, you know, one key objective of any such, you know, dialogue or a discussion. And specifically, once again, for the audiences, as we all talking, the idea would be to bring in questions, specific case studies, you know, what you've seen, been through, or going through, because your question, we don't know who else it may help amongst the audience ourselves right now also. May I now welcome Dr. Mehta for your opening thoughts and comments, please, sir.
Of course. Thank you all so much. Ajay, Goyal, Robinder, Kush, everybody, and Manoj, everybody on this call, for allowing us to join you. You know, I think you have already said most of what I want to say. Kush already sort of said the main message, of course, is that our hearts and our thoughts are with you. Just as a, you know, as a brief introduction, you know, I actually I specialize in infectious diseases, and actually almost exactly 1 year ago, last February, I was in West Africa. And we were working on some projects about how to prepare for pandemics, what happens when, you know, this is like the places where they had the Ebola outbreaks and the Lassa fever outbreak. So we're working on those kinds of projects with the government there. And literally as I was flying back, I found out about the situation with COVID. When I returned to US, a lot of my friends are in New York. And that 1 year ago, March, April of 2020, I went to New York and was working for a few weeks, like on the ground there. And it's the same thing that Kush said. We saw, it's something that no matter how much you talk about and think about, I remember my first thought as I was going to New York, my first thought, I very clearly remember talking to my family that, oh God, I hope this doesn't affect India. And then after, some months, we were all worried, but even like my parents were saying, oh, look, India is safe. There must be something different about the weather or the climate or the immunity. And the whole time, I think in the back of our minds, we were worried. Because of course, just like Kush, I have a lot of family there. My family is in Mumbai, but I spent a lot of time in India growing up. And of course, it's our, it's our country in a way, even though we're not there physically with you. So I think this possibility hasn't been in the back of our minds for a long time. I know it's scary. I know that my friends and family are scared. I know that I'm scared. I also agree that, the best way that, fear can make you paralyzed and make it, and I think the best way that I know about to approach that is to try to talk to other people, can continue with a communication with people you trust and people who care about you, and learn from their experiences. So at least you can't, it's a natural disaster, what's happening now. And it's not something that any one person or small group of people can stop, but we can learn how to cope with it. We can learn how to face it, and we can feel that other people are there and have our, are there and support us and care about us, and are not, that we're not alone. This is one thing I think that we can do. And as we do that, we can learn from each other's experiences, how to address things, how to fix problems. This is India. It's not, the solution is not going to be some big, $1 billion trillion. It's going to be all of these kinds of networks coming up with creative solutions, because India has a billion different problems and it will require a billion different solutions. And you all are on the ground, part of that solution, driving that solution. And we just want you to know that we respect you so much, and we wish we could be there with you, but we are there in spirit.
Thank you. Oh, that's wonderful. Yeah.
Thank you so much, Dr. Mehta. May I now invite Ajay? If you may want to roll up a question, or would you have any question with Dr. Khushboo or Dr. Samar, or your own thoughts?
There's a general question that comes to my mind. See, we were able to control, as you said, the first wave, we were rather able to manage. But I fear that has not been the case with the second wave, which has been very overwhelming and almost come upon us as a tsunami. So as you see it from there, and as an epidemiologist, what do you see, like, what is the real reason? Where do you think we failed? What we could have done? How did it go out of hand? Any observation on that, so that we can be better equipped next time?
Rich, do you want to say something first?
I'm going to let you take that one, Samar, because you have that setting. Then I'll give you my opinion as well on the tail end.
It's, I think obviously that it's a question, we see it. If you read, you read Times of India, you read the news, you listen to what politicians are saying, everybody has an opinion. I will be very, very honest with you, Ajay. Somebody was just asking me, why India? Why now? What happened? Was it this person's fault? And I actually do think that those are important questions, because God forbid, I don't think we're done yet. There will be, in the world, there will be a third wave. And so we need to learn from our mistakes and understand.
Yeah, that is why it's important to get the hang of it.
Yes. Yeah, absolutely. And we all know a lot of people have many ideas. I think when people say, why India, why now? My response, at least initially, is, like in last March, why New York? Why Italy? Why those? I don't think we know the answers. I think there are many questions. Did we let down our guard? Were we not doing enough social distancing? Did we not, did we not go enough with vaccinations? Were there too many political, there are many possibilities. And the same thing was happening last year. Oh, why is it New York? Is it the climate? Is it the weather? Is it because the density is there? Is it because so many, and I don't know the answers. And I think, in my opinion, I think it's too early to, we can always speculate, not too early to speculate. It's too early to know the answer to that question. And at this point, at least in my mind, the focus, I keep thinking, I try to keep telling myself, these are questions that we need to ask, but in the moment, we just have to accept the fact that it's here.
No.
And you take that as a starting point. So I don't know the answers. I think all the same things you are hearing about why it happened are the same things I'm hearing. I don't know any public health experts that have a definite point that they could say this is what caused it.
Okay. Right. So now what another point which keeps us wondering is, because you see a lot of, as you said, creative solutions are being applied. And then on top of this, we have this, what you call WhatsApp university. People are throwing in all kind of ideas. So we don't know how to sift the good from the bad or from the right from the wrong. We don't have real method to do it. But over this time, over these experience, now we aren't that new to COVID, like we've experienced it for good a year and a half, a little more than that. So is there a standard protocol of medicine or something that has evolved over this period, or are we still struggling? What is the real crux of this, and what are you exactly doing in US to treat a patient?
Excellent question. Kush, do you want to start with that one?
Sure. So you're absolutely right. We've sort of evolved, but I will tell you that we've evolved in a direction that we still have a lot more questions than we do answers. So, essentially every medication that we could come up with, because as physicians and as a medical community, we don't like to see people dying. We don't like to see people suffering. We think that we need to find an answer. So if you looked, and if you even do a Google search, you will see every kind of medication, any thought, any hypothesis that anyone had about a specific drug or pill was put out there, and people tried it all. And what we've seen is that a lot of that has not helped. Essentially. I can definitely go into specific examples, but let me just start with the medications that we have seen some results with. Okay, and this is again a data that has been available for a year. Now, in order for things to be perfected, in order for therapies to be perfected, it takes years for that data to come together. And we are going based on a year worth of data. There has been some trials that have shown some mortality benefits. So let me explain what trials really means. And because I think a lot of people have put this out there and I've read about it, and everyone is saying trials this and trials that. So what trial essentially does is that you take two subset of groups, okay? They have almost identical features, condition. Both of them will have COVID. One group will be treated with medications that we think may work, and the other group is going to be doing, whatever is already accepted in the community as the therapy of choice. And then we compare the results and see, hey, did adding this medication really benefit the patient, or that it was just the results were the same, right? That's how we come up with whether a medication has worked or not. In that scenario, what we've seen is that steroids, and I think you guys have that there as well, the dexamethasone, methylprednisolone, those medications have shown some benefit, okay? Where it has shown that yes, despite, clearly the groups of people that got the steroids versus the group that did not get the steroids, the ones that got the steroids did better than the ones that did not. So that is a clear evidence that we've seen in several papers. There were some papers that didn't show it, but majority of the trials did show that benefit. We've seen a similar trend for a medication called tocilizumab, but that is more into sicker patients. Okay, patients who are in the hospitals, who are requiring ventilators or requiring something called high flows, not just regular nasal cannula that you're able to use at home. So we have some trend of that. Again, is that solid data? No. Not for that medication yet, but it is showing that trend. Certain other medications that you guys have spoken about over there, remdesivir, for example, that there have been several trials, and Samar, jump in anytime you like, which have shown that it may help patients shorten the hospital course. It may help patients very early on in the disease. And essentially just shorten the course. It has not shown mortality benefit as such still. Again, does that mean that it may not? No, but that is not what we're seeing. What that means is that it will help patients very early on in the disease. It will help maybe shorten the course of the disease. But if you didn't take it, would that alter you? Would that be a horrible thing for you? No, it does not mean that. Okay. Same thing with convalescent plasma. We've seen a lot of, we were all on that bandwagon of convalescent plasma here in the United States as well, thinking, okay, let's do this. What we realized was, again, for convalescent plasma, we did not see a benefit really of help with patients. It didn't show a definitive benefit that it helped patients. As compared to patients who didn't get convalescent plasma. And when it did, the few studies that showed some benefit, it was very early on, before 7 days. And I think all of this data is actually reflected on the guidelines published by the AIMS Institute in Delhi, and just the Indian Society of Critical Care Medicine. And they have very clearly stated this, which I've reviewed, I know Samar has reviewed, which says exactly what we have been seeing on this end, or our end. Okay, so I think that some of the medications are hyped a little bit more than others, but I just want that everyone here on this panel and just people in general really understand what the utility is of it. Does that kind of answer some of your questions? Samar, please jump in.
It does give a direction, certainly. So another thing, maybe I can ask.
Maybe
Can I ask a question here?
Who has a question?
I have a question.
Yeah,
Vikram,
please.
Yeah, so see, I have been infected twice, last year as well as this year, and my biggest fear is that last year the medicines which were prescribed to me were different. This was in August last year, and this year I was prescribed kind of different medicines, but the trend this year is very different from what it was last year. So the fear is that people say it has mutated, it has changed its form, the medication has also changed. Is the vaccine going to be effective even in the future when we say there's a third wave, fourth wave coming, and the virus is mutating? So are we going to be safe with these vaccines, or biggest fear is, will these vaccines also be ineffective when the virus mutates?
Dr. Samar.
Samar, do you want to try that? Yeah.
Yes, of course. No, I'm sorry that you've been infected twice, but I can smile because at least you look healthy and well now. So I know you've recovered twice. So that's a achievement.
There's a better way of looking at wow.
Yes, exactly.
And here, double the immunity.
That's yes. No. I'll smile twice.
Right.
Thank you.
I think we should make you director of WHO, because you're asking exactly the same question that I think is in all of our minds. We are very much, the whole world, not just India, not just US, the world is counting. I think we've been counting now, just holding our breath, thinking that the vaccine will solve all of our problems. And if we could only vaccinate enough people, then this will be gone. I hope that's true. But you are 100% right that we are hearing now very much about this India variant. The technical name you will hear, it's called variant 617. That's the number of the variant. There are many other variants in different places: Brazil, South Africa, UK. Just like any virus, this virus will mutate. And you are absolutely right that, for example, with the HIV pandemic across the world in the last 30 years, we've definitely seen some medications working, and then after a few years, they stop working. So it's all good questions. Until now, and this is changing day by day, until now, the research we have shows that in India, we have two vaccines available currently, right? We have Covishield and Covaxin.
Right.
Yeah.
So the preliminary data shows that Covaxin, this one is the one that's made by Bharat Pharmaceuticals, is effective. They a team from India just published some studies saying that it is effective against this new 617 variant. And the AstraZeneca or the Covishield vaccine might be slightly less effective, but it's still working in some way. So in other words, it will not protect you 95%, but it seems to protect you at least 70-75%. Again, the numbers are changing day by day. So it's not a perfect solution. Tomorrow there may be maybe even another variant. They call it escape, that escapes from the vaccine. So those escape variants are possible. We're trying very hard to track them. But until now, I think the belief on both sides of the world, but my colleagues in the US and my colleagues also in India, the consensus is that the current vaccines do seem to be mostly protective, and they help, and the dangers of those vaccines is little. So I am hoping, we're all hoping that those vaccines will still provide a benefit. Of course, what happens 6 months from now, I can't promise. In COVID, I've stopped promising anything because you never, the situation changes so fast.
The data is not firming up. I'm still early.
Now, one other thing I wanted to kind of point out, and just to kind of add to Samar's point, is that, I think a lot of the questions that we have, we feel like when we take the vaccine that we're going to be fully protected. That means we're not going to get COVID, nothing is going to happen. That is not really the case when we get vaccinated. What you're hoping for is, let's say, if you do get the virus, that the effect is not as much. So it's minimal. You want it to be on the milder side rather than on the severe side where you end up in the hospital, you're requiring ventilator. That's what we are trying to prevent. And that is what we refer to when we say 95% effective or 67% effective, right? So that is the hope. Go on, Samar, sorry.
Yeah.
No, that's perfect. I hope, Vikram bhai, I hope that answered your question.
I think Kalpana has a question. Kalpana?
Thank you.
I think is Kalpana there with us? Hello?
Yes. Oh, sorry. Just a sec. I was on mute.
Yeah, please.
Okay. The first part of my question has already been asked by people, like how well we are protected from the vaccine. What I wanted to know is, because you have so many people in different groups telling us you should do this to protect yourself from COVID, do that. Can you suggest, you as doctors, can you suggest what exactly, the basic precautions, all of us who haven't had this and you do not want to have this, what do we do? Kind of protect ourselves from. Right. They say, because you have a lot of people giving us a lot of gyan on WhatsApp universities, then you have internet, so many universities, they tell you do this, do that, eat that, don't go out, it is spreading by air. And then they tell us, wear 2 masks, from 1 it has come to 2 masks. So as doctors, what do you suggest, what precaution we should take so that we do not get infected? Thank you. Was I audible?
I'll let Samar,
Yeah,
yeah, you were. I think I'm going to let Samar answer as the infectious disease, and then I'll add my points to it. Thank you.
Yeah, thank you, Kalpana Ben. Obviously, that's vaccines is still, it's going to take some time for the vaccines to help everybody. I think you're right that how can we keep us, our families, our colleagues, our neighbors safe? That's the question that should be on everyone's mind first. I think there are 2 things. I think we have to, the first thing is there are some items that I think we all agree. WHO agrees, India Institute of Medical Sciences agrees, we all agree that these things are effective. So I think we all agree that wearing masks protects yourself, and it, more importantly, even protects others around you. 2 masks is nice if you can. It's not always possible, but yes, the idea that anytime you cough or you sneeze or you talk, any small saliva comes out, if you have 1 mask, even better 2 masks, that saliva is caught and it doesn't go in the air as much. So that masking, I think we have learned and we have seen, as you all have been hearing and knowing, that it is effective. It decreases the risk of you spreading the disease to someone else, and it also somehow reduces the risk of you acquiring the disease. Of course, it's not easy. And again, this is India, and so I know that it's a crowded place. It's not always easy to, if you're at home, you likely have many other family members in the house. So you have to recognize that you can't always do it. It's difficult to wear a mask all the time in the house. But certainly when you're outside, when you're in crowded places, and as I talk to family in Mumbai and Delhi, in the metros mainly, but as I talk to those family, I'm hearing that at least in March, before this second wave, that I think a lot of people had let their guard down with masking, and we were seeing people in the markets outside just going about business without masks. That's fine. Everybody is sick of it and tired of it. But I think we need to reinvest in that and refocus on that, because this is one thing that we know helps. Obviously, just basic, hygiene as much as possible, the same way we always just are conscious, washing hands, those things that if you go outside and you come back, be very careful to wash hands. If you bring, groceries, shakbhaji, something, if you bring it back into the house, just make sure you clean the containers. Just be conscious of hygiene, those simple, basic things, but do it double the way you would do it ordinarily. All of those things help. They don't hurt, and they're relatively easy that anybody who has access to water and some masks can do. And then the third proven thing is just be aware. Obviously, like you all on this call know this, but just you have to be honest and ask yourself that, how am I feeling today? Do I have fever? Do I have temperature? Do I have cough? Most of the time, I think if I wake up in the morning and I have a headache and a little fever and maybe I'm coughing and sneezing some cold, I'll just say that's fine. I'll drink some tea and I'll go to work anyway. I think we have to be conscious and monitoring of our own symptoms. That if we notice that we're starting to get mildly sick, then just be extra cautious around family members, if possible, to get a test, because catching it early in yourself is a big thing that you can do. So those are the three proven interventions: monitor your symptoms, wear masks as much as possible, and careful hygiene with hands and items coming from indoors to out of doors. I think the other thing that people will ask a lot, you'll hear about vitamin C, D, and E. You hear about zinc. What foods are there? My response to that is, I think what Khush was saying, that as doctors or scientists, we have some things we can do that are proven, that we know, studied, researched, that those things helped. There are other things that we don't know. Of course, we all want to do something. My response is, if you hear some advice to eat more healthy and take more vitamins, by all means go about it. It will certainly not hurt you. I don't think any definite guidance on any foods or intakes or medications even or vitamins that can prevent it. But as long as they're safe, as long as you're not doing something ridiculous like taking so many handfuls and handfuls of zinc, I don't think that I have no problems with you doing whatever you believe is reasonable again to prevent it. Just knowing that none of those things are a guarantee. Khush, do you want to add anything?
No, I completely agree with you, Samar. And I like he was saying, I think that the hygiene part, I think, is the most important, especially, I know even like Samar was saying, in my families, we have a limited space in the home. And so, just sort of kind of think twice, okay, do I really need to go out and do this today? Going to temples, for example, any kind of religious place, really do think if you need to be there. And if you do need to be there, then definitely wear a mask. If you notice someone that is around you who is not in a mask, and obviously you can't just go out there and be like, hey, please put on a mask. So what you do is you just distance yourself from that group, just sort of be about at least 1 meter away. I agree with Samar exactly. Hand hygiene is extremely important, bleach and all of those things are great to clean your counters and stuff, but you have to be very mindful of washing your hands and not allowing it to go near your eyes or your mouth or your nose. And then if you are sneezing, just common things that we do, just courtesy, when you're coughing or sneezing, just make sure you cover your mouth. Or move away from someone who is doing that. So just things like that, I think, will be of most importance. I think on the other hand, if you do identify someone who does have, who is positive for COVID in your home, maybe one of your family members, I think at that point, the family member, whenever you're going to interact with that family member, and correct me, Samar, if I'm wrong, but, we do advise that you put on a mask and do that. Make sure that you clean their utensils. Make sure that you sanitize the areas that they're in. Make sure that you have minimal contact with the respiratory secretions. Anything, any cough or phlegm, sputum, all of those things. So those things I would kind of watch out. Just kind of don't. And I think everyone is extremely mindful of this in the current situation. I think everyone's taking a lot of precautions, and I think that's fine. Just kind of be mindful of things that we maybe 2 years ago were not mindful of, or we never thought that we needed to not, be aware of someone coughing around us. Like that was never something that would raise your eyebrows. And now I think it's something that you'd be more careful with.
Okay.
Thank you.
Yeah.
I think there's a question from Dr. Gulshan. He had a message on the chat. Dr. Gulshan, you have a question, please?
Yes, sir. I have a question, that is, if the person is vaccinated immediately, so some COVID-19 symptoms appears within 1 to 3 days. So in such state, such person can also be the spreader of the COVID-19?
No, I mean, there are some very, very unusual kind of rare cases, doctor, that as you, I'm sure you know, that that where somebody happens to get COVID the same day that they got the vaccine by terrible luck, by bad chance, But this is by far very, very, very unusual. If you have some mild cough, body aches, mild fever, everything in the 3 days after COVID vaccine, it is impossible, physically impossible, based on the way the vaccines are made, to spread COVID to anybody during that time.
Thank you, sir. Thank you.
Okay. Thank you.
So that's so the crux is that we have to maintain a hygiene, social distancing, and be on our alert. We can't let our guard down at the moment. We have with us.
I'll just add up to the question of Dr. Gulshan. Like this vaccination process, like it's generally what basically comes up in the media, and this thing is like once the person gets vaccinated, for the initial days, his immunity level drops down comparatively to a low level. And that is exactly the time when they are more susceptible to catch the infection. Now, why I'm asking this is because there have been certain casualties after a few days of having the first vaccination. So, what would be your take on that? Any kind of measures and safety laws that we need to put in place?
You want me to take this?
And then I'll add to that.
Yeah. No, I think Manoj bhai, that's also like that's important, and I think that this is, vaccines are an amazing thing. It also makes people nervous, and even as doctors we have to be careful, because if the vaccine itself causes a harm, we feel additionally guilty because we're giving the vaccine to a healthy person. It's not that we're giving it to someone who's already sick, right? So that we have to be very careful not to hurt somebody who's healthy. That's the opposite of our job.
Yep.
So let me so I completely agree and appreciate what you're saying. Let me just make two comments. I hear many times that your immunity is decreased after vaccine. I'll tell you, actually, that's not true. What the vaccine, it's actually, if anything, it's the opposite, that what the vaccine does, it encourages your body to increase immune response. So that's the whole point of the vaccine is body, you're being attacked. You need to make fever, you need to tell the body that it's sick so that you can create a response to fight the intruder. In the vaccine, the intruder is a false intruder. It's not really dangerous. But the whole point of the vaccine is to trick the immune system to become more active. So we might feel body aches, fevers, general weakness down after vaccine. You are not, of course, as far as we know, in all the years that I've understood and studied vaccines, you do not have an increased risk of acquiring new infections after the vaccine. That's number one. Number two, I think, is also, you raise a very good question, which is what happens if there is a casualty or a complication after vaccination? And that also we worry about very much. Of course, on a personal level, we never want to give someone a medication that will hurt them. Also on a community level, if somebody suffers complication after a vaccine, that's terrible because it hurts people's trust in the vaccine, right? If you know a family member who had a complication, you yourself won't want the vaccine possibly. I can tell you that as far as I will tell you, number one, I got the vaccine. So as a doctor, I had to receive it early, not to protect me, but to protect my patients, right? Because I didn't want to give my patients the COVID. So I will tell you that I got, and 80% of my colleagues got the vaccine the first day it was offered. Nothing in life is a guarantee. It is a possibility to have a complication. There are some very rare complications, maybe one in a million, 1 in 5 million. There are complications even that can cause a healthy person to die after the vaccine, but they are incredibly rare. And I would vaccinate myself immediately. And I think in the end, what the message I say that I try to tell people is, look, God forbid you have some complication for the vaccine, but this is a 1 in a million chance. As you are walking around India right now, your chance of being personally affected and ill from COVID is much higher than that chance. So it's not perfect, but it's definitely safer than not being vaccinated. That's my response. I don't know if that answers your question.
No, that makes sense.
Yes. Secondary to this thing, thank you so much, doctor. There is like a test by the name of CRP, which is being, generally before getting the vaccination, some people are, getting the reports done for CRP to see whether they should go in for the vaccination or so. How true is that, sir?
Kush, do you want to take that one?
Yeah. So CR.
Can I just ask one clarification?
Sir?
Manoj bhai, it's confusing. There are two tests. One is called, as you say, CRP. The other one is called PCR. The one you're talking about is CRP, not PCR, right?
Actually, I'm not
I've raised my hand.
either of these.
Okay, what I'll do is, since we have Dr. Alok with us.
Unmute se maine kar liya.
So
I've raised my question. Let's see if they ask me.
Sir, we'll just come back to you, sir. We have with us Dr. Alok Jain, Josephied Dr. Alok Jain, who's working, who's a doctor with a government hospital, working for the government. Could he further extend his query on what Manoj has to say? Dr. Alok, what is your experience? You are dealing with COVID patients day in and day out. You have to unmute yourself, Dr. Alok. You have to unmute yourself first.
Yeah. Yes, sir. Good evening, sir.
Good evening, Alok. Yeah, please.
What Manoj is asking is about C-reactive protein. There's been a saying around that if CRP is raised above 1, then it shows that body is inflamed and one should not go for vaccination. It can cause complication. So I just want to ask, what Manoj has asked them, let's share their experience, sir.
Okay.
You would like to ask Dr. Samar and
Dr. Khushboo
about this question, sir.
Thank you for that clarification, Dr. Alok. Kush, do you want to take that one?
Yeah.
Yeah, so thank you so much for what you're doing, Dr. Alok. We really appreciate it. You're there on ground, and by all means, thank you. And we are here to support you, absolutely.
Thank you.
So here no, absolutely. You guys have been doing a phenomenal job there, so no question about it.
You there. Heard a bit. Yes, absolutely.
Yeah, absolutely. Hats off to you guys. We do not check. Yeah, no, I hear, but it's a different level of duty when you put your life at risk as well. So we have to thank you appropriately. We here do not measure CRP before we take vaccinations. Okay, and then Samar can kind of weigh in on that as well. But we don't CRP. The only time we're measuring CRP is when a patient is confirmed with COVID-19 infection. That is to kind of guide us with the inflammatory response in the body based on that infection. But we are not measuring the CRP prior to vaccinations. At least I have not seen any data that has shown the effectivity of the vaccine being reduced or increased or side effects that are related with CRP. I'm sure that Samar will be able to kind of shed some light on this as well. But giving vaccinations, I think even after you've had a COVID infection, per the guidelines in United States and per the World Health Organization, the WHO guidelines, we recommend that once the symptoms have completely subsided, you can take the vaccination, be it 2 weeks or 4 weeks. And I believe from the Indian guidelines, it's about the same. Only thing we caution about usually is if you guys have taken plasma, convalescent plasma, at that point you want to wait for 90 days before taking the vaccination. So that should be the only instance that, at least here in the United States, we recommend that you wait. Otherwise, we encourage people and we do not test for any of those things. And as, Samar has been echoing, here, we were among the first groups who got the vaccinations. I myself, after the first vaccination shot that I got, and I got Pfizer at that point, had some soreness in my arm. I was able to work throughout. After the second vaccine shot, I had some chills, I had some body aches, just like you would feel with flu or just when you're under the weather almost. And it disappeared after 24 to 36 hours. I was able to work throughout. through all of this. And like he said, it is more that you're giving your immune system a boost. It is not shutting you down. So by all means, if you are able to take the vaccination, please do so. The course is to, avoid people going into hospitals, avoid overloading the health system. Mild disease and kind of getting over is what we're hoping for, essentially.
Right.
Okay.
Yes, I agree with you.
Okay.
Thank you, ma'am. Thank you, sir.
Thank you. So
Can I just add one comment?
Yes,
Sure,
please,
please.
doctor.
No, and I completely agree with Kush. We definitely do not check CRP before. I will say, one thing, obviously the day-to-day practice and approach is different in India. We all know sometimes places like US will assume that the management pattern here must be the management pattern everywhere, and that's not necessarily the case. So many things can make CRP go up. If you have an appendix problem or anything, inflammation will make CRP go up. What I would say is, if you are checking CRP, if CRP is very, very high beforehand for somehow, ideally, the best thing, you ask your doctor, is it safe for me to get the vaccine? Now, the problem that not everybody has access because people like Dr. Alok are working nonstop.
Yeah.
So, I guess the answer, I agree with Kush. I don't think there's any official, I've not seen any official guidance about checking CRP prior to vaccination.
Even I agree with you.
Okay, good.
Great. So sometime back, I saw the name on the screen of...
One more question, sir. One more question I wanted to ask them.
Yeah, doctor.
What has been their experience with Rapivir and Remdesivir in USA? Hello? Hello?
Yeah, you are audible, Dr. Alok.
Yeah, sorry, you got cut off for a second. I don't know if someone was able.
Yeah, I think you were.
I just wanted to ask. You, what is your experience with this Rapivir and your Remdesivir? Like, what has been your experience in USA?
Yeah, Favipiravir we actually don't have in US. It's not available in US.
Okay.
We do have Remdesivir. Kush, do you want to talk about Remdesivir a little bit?
Yeah, absolutely. So with Remdesivir, initially that was the only medication that we had in the United States for a very long time after dexamethasone. So what we do here essentially is we give Remdesivir for mild cases, meaning patients who have not yet been started on, if they came into the hospital who have not been on high flows or optiflows, if you have over there, or BiPAPs or CPAPs. We start them off early on because we think the benefit is early. It's, early on into the disease process rather than later on. Have I seen mortality benefit as I'm speaking to a physician? No, I have not. And I think I agree with the studies which show that, there's not really a true mortality benefit, but has that decreased the hospital stay? Again, in my experience, we've given it to all the patients that are in the hospital. So I can't speak for that, whether it has helped with the hospital stay. The hope is that it does help. In essence, hello, am I there?
Yeah, you are.
Yeah.
We can hear you.
Yes.
Now you are mute.
I think I unmute myself. Okay. Can you hear me now?
Yes. Yeah, sure. Yes.
Okay. So that's how we are using Remdesivir essentially, is early on. We do not start it, or at least in my experience, I and my colleagues here, per our criteria in the hospital, we do not start it if patients have, we look at the renal function, we look at the LFTs, we look at all of the liver function, we look at all of those different things when we start the medication. So essentially, it's early on that we try to use it. We don't initiate it after they've progressed all the way to ventilator. We're hoping to have caught it beforehand in the hopes that they won't get there. Does that make sense?
Yeah. We do it around day 7 usually. Once this oxygen starts falling and they come in the hospital, and that is the time I think.
Yes, exactly. That's when once they come in the hospital, exactly at that point, we start them on the Remdesivir. We don't wait until later, if that makes sense.
Yes. I agree with you. Yes. Thank you so much.
Yes.
Can I just add one comment? And I think Uncle in the one bhaiya who has had hand raised for a long time. Let me just make one comment and we should get to him. One additional comment that, Dr. Alok and Khush, I think we all are on the same page for remdesivir. One thing I will say, when it's easier to have this conversation in theory on Zoom, WhatsApp, anything. If it's your family member who's sick, people will do anything, go to any lengths to try to find some way to help them.
Right.
And I talk to people who have bought remdesivir on black and who are spending literally lakh rupiah to buy that remdesivir.
I know.
I would just listen to what Khush has said, that we have looked very carefully. We are all desperate for solutions. No study has ever confirmed that remdesivir saves lives. It might speed things up, improve you a little bit, but nobody has ever found that it saves lives. I'm not going to tell you don't do it. Of course, when Dr. Alok and people are giving it in the hospitals, there's a specific reason for that. But I get very sad when I hear that people are spending lakhs of their savings buying remdesivir on black for something that they're desperate, but it's very unlikely to change the result. Unfortunately,
we are using it very rationally. I mean, we are not giving it to each and every patient. Thank you so much.
I wanted to ask.
Yeah, Randir.
Yeah, I wanted to ask both the panelists, what is the general time span of the disease from symptom to recovery? What is the basic time span generally it takes from the manifestation of symptoms to the time you recover? If you do not have breathing issues, oxygen issues, if you're recovering in your house, what is the basic time span?
So that's a great question. I'm liking the questions because we're moving towards recovery rather than starting the disease. So in my experience, what I have seen, because I practice in a clinic and I practice in the hospital, and I have seen patients who are, who have never needed to come to the hospital. It has varied. Okay, so some people, essentially a lot of people do improve within the first 2 to 3 weeks. Okay, post-diagnosis. But a lot of the other people I have seen have had symptoms, whether it be fatigue, whether it be you're just not feeling like you're thinking clearly, whether it be muscle pain, whether it be you're not able to do all the activity that you were able to do previously. And that has gone up anywhere from 3 months to 6 months. Now, if you had a longer course, meaning if you had to be hospitalized, use some measure of oxygen, then that course becomes even longer. Okay, so I have had patients, because I do COVID recovery clinic as well in my hospital here, and I have had patients who have finally recovered at the end of 9 months or 10 months. So that is not unusual. This is unlike any other viral infection that you might have, or any other bacterial infection that you might have, where you usually notice that, okay, I gave you antibiotics for 2 days and you're good to go, or 2 weeks and you're good to go. That is not how this course works. Some people are, seeing symptoms that extend all the way through a few weeks to all the way a few months. So please don't be surprised with that and don't lose hope. As long as you are continuously improving, if you notice that this week was better than last week, you're making progress. Okay.
Thank you. Thank you.
Can I ask you a question, please?
Yeah, sure, please.
I am Jaideep Sani. Good evening to everybody.
Good evening, sir.
I have taken the second dose of Covishield about 20 days back.
Right.
I want to know how much time it takes for the antibodies to become perfect and make me properly safe with the vaccine.
Okay, Dr. Samar, can we have a word on this from you?
Yeah, of course, Jaideep, good question, and congratulations. We've only did everything we're learning, because the Covishield vaccine, we only started giving it 2-3 months ago in big quantities. So it's not that we don't even know the long term, but I will tell you that if you finish 20 days ago, your immunity your protection from severe disease is already 80-90%. You're already in a very good place. It usually only takes a week or so, 1 to 2 weeks for that immunity to build up. And especially even second dose, the response is faster. So if you, 20 days after the second dose, congratulations. I feel better about your safety now.
Thank you so much. Thank you so much. Thank you.
Right. So I want to invite.
But just to add to that, please do not forget to still wear your mask though. Remember,
Exactly.
I wear a double mask when I go out.
That you shouldn't forego. That's important. I would now request a very senior Josephite, Mr. Rajiv Nangia. He has a question. He's been, so I invite him over for his question. Rajiv, sir? You have to unmute yourself, sir. You have to unmute yourself first.
Good
Yes.
evening, everybody. I hope I'm audible enough, especially to the panelists, Dr. Samar and Dr. Khushboo. My question to you is that I am a senior citizen. I am 70 years plus, and like Vikram, I am also a COVID survivor. I had this attack of COVID in the month of September, and the standard line of treatment in India for not so serious cases is a combination of a drug called ivermectin along with an antibiotic called doxycycline 100 milligram BD, along with a heavy dose of 650 milligrams of paracetamol 3 to 4 times a day. And in my case, I was put on a drug called Fabiflu. Now, what happened is that of late, because in our house, we have a couple of families staying. So one family has tested COVID positive. Now the doctor has recommended those 4 drugs again. I have had to undertake a C-reactive protein test. I want to know how important is the yardstick or the measure as far as the C-reactive protein is concerned, number 1. And number 2, how safe is it for the patients who have tested COVID positive now to be able to mingle around with people? And as far as the family is concerned, is it okay? Is it all right if all 3 of them have tested positive if they stay together? So these are my basic questions, please.
Okay, Dr. Khushboo, can we hear you on this?
yeah, absolutely. So in fact, what I'm going to do is I'm going to let Samar discuss the first part of it, and I'll answer the second part of his question. So go ahead, about the ivermectin.
That you're going to make me answer that, huh? Yeah.
You're the infectious disease specialist.
Uncle, thank you for asking that question. And again, it makes me smile and feel better to see that even as a senior citizen, although you look very young and healthy, but it makes me feel good. It makes us always feel good to talk to someone who's survived and done very well afterwards. I honestly, I think in a way that's really a question. I don't want to put him on the spot, but that's a question for Dr. Alok, because that the guidelines vary a little bit. The national guidelines, although it varies, but the national guidelines really do say ivermectin for sure. And I know many people are doing doxycycline. The paracetamol certainly. I have some thoughts, but Dr. Alok, do you want to talk? Just if you don't mind, if you don't feel pressured, just at the standard regimen.
Yeah, that is the standard regimen which we are giving here in India. Ivermectin, the theory behind it, I don't know if it's there that it reduces the hyperimmune kind of thing by removing the worms and all. So there have been some papers also which have been claiming that ivermectin can really help. So it's like, well, we are just giving it, and I have no, no certain proof about whether it really helps or not. And paracetamol, what I feel about paracetamol is that the fever should not come. The lesser is the fever, the lesser is the inflammation, lesser the chance to go into a kind of, into those cytokine storm and all. Rest about doxycycline, I don't know if there's some proof, but we have been giving it as a standard protocol.
From what you are saying, one does realize that it's all God is kind and to people and
No. I mean, government of India is put up this protocol. I don't know how it works, but all we look is for the fever and then recrudescence of the fever and fall of oxygen. And
but
then,
since you've done number of cases,
what-
okay, let me ask you like this, Dr. Alok, since you're handling it day in and day out, after you administer these medicines, have you seen any relatively better rate of success of patient recovery, or have patients shown some symptoms of recovery after you administered these medicines? What is your observation? Okay, let's share that.
So many of the patients are getting all right on all these medications, sir. But there are certain subset which come to us with fall in oxygen, and then we have to admit them, put them on oxygen. And
so what you're telling us is varying from patient to patient, is it?
yes. But a large subset is recovering on these medications. It's not that everybody needs. Actually, we get skewed. We don't come to know how many patients have recovered. We are seeing the patients who are coming in the hospital. So I think a lot of patients are recovering on these medications. They're going back. And what is working? Yes.
Your general observation is patients are benefiting out of this protocol.
Can I add?
Yes.
Can I add to this, please?
Yes.
See, first time around, last year when I fell ill, my medication was azithromycin 500. It was paracetamol, and it was levocetirizine. Right? That's it. These were given to me for 5 days. I was monitoring my O2 and my temperature, and exactly 13th day or 12th day, I had no fever. 14th day, I was out. My doc told me isolation is over. Isolation was of 10 days, and that's it. And I was very happy to have survived. This year, when I fell ill, the medication was totally different. It was exactly what Nangya sir mentioned: Fabiflu, ivermectin, paracetamol, doxycycline, and zinc, which was Zincovit. These were given to me for 5 days. After that, something happened. There was a gap. My doctor was not available, and I went to some other doctor, and he started me off on doxycycline again for 7 days. The difference was that in the first phase, in 14 days, I was absolutely out of it. So this time also I started counting the days when the fever started, and I was, looking forward to two facts. One was that I hope my oxygen doesn't go down, and number two, the moment I hit the 14th day, hopefully, but that did not happen. It continued, the fever continued, small, even though it was less, it continued until 21st day it continued, when I actually was fed up and I gave it up, that, this is too much. I can't bear this. It was only on the 25th day that I now felt. So 2 points I'm making. One is that the medicines were totally different, but the end result was recovery. So I don't know what works and how it works. Thank you.
Yes. Can I respond to that?
Yes, Dr. Samar, please.
Yeah, I've already I think said one time, I'll say it again, that I think Vikram Bhai should be director of WHO. Because I think you made a very good point, and it is based on also something that that Nangya Saab mentioned and Dr. Alok responded. That look, these protocols and these medications, maybe it will be, you're talking azithromycin. Back even in US, there was a big argument, if you can remember, and it was very, very popular in India. Also, people were taking hydroxychloroquine for some time, although I think that's because
even that was on. Right.
So I guess the first answer is, I'm going to say this because I know if I don't say it, Khush will say it. Let me just say what she said at the beginning, which is, and this is why what is very important in what Vikram Bhai is saying. Dr. Alok makes the point that, these people are getting better after 5 days. What Khush's point at the beginning was, if you take 100 people, everybody on this call, 50 of them you give ivermectin, and doxycycline. 50 of them, you give nothing. You give paracetamol and water and prayers. After 7 to 14 days, 90% in both groups will be fine. So the danger of saying, oh, are you observing that doxycycline, ivermectin, zinc, those things are helping? People are getting better. Yeah, but people get anyway. So I think, you know, the All India Government of India guidelines current are changing. They do say right now currently to give ivermectin, you can consider doxycycline. There are some situations where a medication like azithromycin or doxycycline, maybe cetirizine, one of these things is appropriate. There are also some situations, if you have some liver problems and you start taking so much paracetamol, that can cause problems. So if your doctor, if a local doctor, if you're able to see a doctor, your doctor on the ground says, take these medications, by all means, I will not argue with them. They're the ones there. They know the big picture. They know your circumstances. No problems with that. I will tell you that the attitude from the science and studies is that Kush mentioned steroids. We talked about remdesivir. There's one or two other ones, but these ones, the ivermectin, the zinc, the vitamin C, the doxycycline, the azithromycin, none of them is proven. If your doctor recommends it, by all means, I would take it if it's safe. The downsides are quite small if you take it as prescribed. Ivermectin is a very safe drug, unlikely to hurt you. But unfortunately, and I don't want to say this because I, of course, don't want people to feel down, but I would not expect any of those medications to make a 180-degree change in anything. If your course is improving, it will continue to improve. If your course is worsening, ivermectin will not save your life. Has been my experience. Kush, do you want to?
I completely echo that, and that's why I wanted Samar to kind of give you guys, information about this. Essentially, is that from my experience, here in the United States, we were not giving ivermectin. Now that has nothing to do with was it good or bad? It was just not a medication that we started to use. And remember, I told you early on that we were trying to use whatever medication we thought we had a hypothesis is going to work. We were giving it, including hydroxy, all of them, like anything that we got our hands on that we thought would work, we would give. Sometimes we were giving azithromycin and doxycycline if we thought that there was going to be a infection on top of it. That is not a viral infection. And that is what the on-ground physician might assess. They may think that, oh, you know what? You're at a risk of a secondary infection. Let me throw you on doxy or azithro or whatever other antibiotic. And that's fine. And I think that those medications should be reserved for the physicians to decide on. And just as Samar said, they have done studies on these medications, and that has been shown that they didn't really make a very good impact. It didn't really help the course or, take them off the course, essentially. And so, I would say that if your physician on ground, just as Samar is saying, says that you need to take this for whatever, other processes that they may think are going on along with the COVID, by all means do so. But it is not a strongly held, they're not the meds that are going to make, make or break anything in COVID, essentially. Okay, so I agree with Samar and I agree with Dr. Alok, all of them about, the thoughts on these medications.
So
may I say something?
My question about a COVID positive family, 3 members staying together and not in isolation. I would request you to please give me your expert opinion on that. And the next one was that how long after the patient has become afebrile or there's no fever, after how long can he or she mingle around with the rest of the family?
So the first, Mangesh Saab, I'm sorry about that. Those were very important and we got distracted on those questions. The first question, 3 family members all infected with COVID. Unfortunately, it's quite common. They can absolutely stay together. They need each other's support and they've already acquired the virus. There's no benefit from taking these family members already stressed and separating them. No, if they're already infected, by all means, leave them together.
Okay. And the second part of it,
So this, I agree with Samar. The first part, if you guys already all have COVID, please, that's okay for you guys to stay together. There's no reason for you to separate yourselves. The second part is how long do they have to stay in isolation after their fever breaks? Per the guidelines, which are similar in WHO and also in the Indian guidelines that are put out, I think they all say that if you are afebrile for 3 days in a row past the 10-day mark of isolation, you may take yourself out of isolation. And someone correct me if I'm wrong on that.
Nope, that's exactly right. Minimum of India, government of India says minimum of 10 days from onset of symptoms, but no less than 3 days without fever. So it can be 10 days, but if you have fever on day 9, then you have to continue for 3 more days add. And that, by the way, that is without paracetamol. So you cannot just take paracetamol, make the fever go away and get out of it.
Yes.
3 days where your body is not making fever despite no paracetamol, that's a sign that the virus is declining.
So is this?
And that's when you can come out of isolation.
Dr. Khushboo, what happens in the case of a patient who is asymptomatic? There is no fever. I don't know when our gardener, for example, he acquired the infection. I got him tested 7 days ago. He didn't have fever at that time. He still does not have fever. So how long do I have to keep away from him? Because me and my wife both are COVID negative. We've taken both our doses of vaccines, so we are relatively on a safer wicket. So that is my question for asymptomatic.
I would still do the 10-day isolation from the time that he was diagnosed. Since he was asymptomatic, the day that you found out he was diagnosed with COVID, I would do 10 days from that time. And then since he's been afebrile, he doesn't need to go beyond the 10 days. And you're saying this is that he doesn't have fever and he has not taken any paracetamol, correct?
Yeah, he hasn't been on paracetamol. I did give him an antibiotic because, I just thought that I should give it to him on my doctor's advice. My doctor said, again, the same thing. He said that start him because he could be having a cold, cough, fever. So he said that please start him on an antibiotic.
Azithromycin.
So antibiotic will not have it's just a paracetamol. It's something that reduces the fever. So that's okay about the antibiotic. I would still keep him in isolation for 10 days. Someone correct me if I'm.
No, 100% agree. If someone has no symptoms, 10 days from the test, from the confirmed
Thank you very much. Thanks a lot.
So coming to Robinder.
Just something, Ajay, please. I think we have a couple of more questions people asking, but then we are mindful of the time of Dr. Samar.
That is what I'm about to say.
Right. So there were 2 questions, I think, still Ashwani Prasad, Sachin Agarwal, and Saurav Luthra wanting to ask. I leave it to you, Ajay, to monitor or to moderate.
What I'll do is, I would, Dr. Saurav Luthra is another doctor with us. So I would invite him over for a question. I'm sure he has some real queries of his slave. So Dr. Saurav, please, can we have your queries?
Yeah, hi. So actually, I just had a couple of quick questions. One is that a lot of mucormycosis is being reported in patients on high-dose steroids who are recovering from COVID. So do you have anything as a prophylaxis to prevent mucormycosis? And is methylene blue useful? And does voriconazole predispose a patient to develop mucormycosis? So this is my first question. So I'll tell my second question once you've answered this.
So Dr. Samar, please.
Yeah, maybe actually, Kush, do you want to talk a little bit about fungal infections that you've seen in the ICU first, or do you want me to just respond? It's an excellent question. It's a very complicated question.
Yeah, you can go ahead and respond, and then I'll tell them if we had this experience, which we haven't had much of it. So, but go ahead.
Dr. Saurav, it's a really good question. So here's what Saurav is asking about is, that it's actually something related to something that Manoj Bhai was asking before, that although the vaccine does not decrease your immune system, the steroids, we talk about this dexamethasone, Solumedrol, those medications actually, that's their whole job is to decrease your immune system. So we're trying to decrease the immune system because it's not only the virus, COVID, the SARS virus that's causing the problem, it's your body's inflammation. So I believe what Dr. Saurav is asking, sometimes in these very sick patients who have been on steroids for a long time, their sugar goes up and their immunity goes down, and they can develop an infection with a mold, a fungal infection called mucormycosis, which can be devastating and can be very deadly and is a unfortunate outcome in some cases of COVID. Am I understanding you correctly, Dr. Sarab?
That's correct. Yeah, Dr. Samar. Yeah.
And I will say that so I don't. These patients actually probably Kush sees them more in the ICU. Currently, I'm working more in accident and emergency, so it's more early in the stage. I actually don't. I know I have seen my colleagues use methylene blue. I know I've seen them. There's been a question about whether voriconazole, changes the flora. The most up-to-date advice I've heard is monitor the sugars closely, have a low threshold to look for these fungal infections. I have not heard anyone saying that vori predisposes you or that there is an effect. I mean, you can't give somebody amphotericin or something as prophylaxis, obviously, right? So I don't know that, at least here, we are seeing those fungal infections and we're just dealing with them case by case, one off as they come, because I've not seen any solid guidelines for how to prevent it from occurring in the first place. It is a known and very scary for all of us risk of high dose steroids for a prolonged period. And I very much sympathize because we're experiencing the same thing, but I don't know, I'm not aware of it. Easy answer to that question. Kush, do you want, maybe you've seen in the ICU some of these?
Yeah, I'm gonna, let me weigh in a little bit on this. So, our course and I think this is where I think a little bit of we may differ. I don't know in India, and you can correct me what you guys do over there as well with steroids. But we are starting off with a dose of 10 milligrams, 6 milligrams for 10 days, and we stop at that point. And if we see, then what we do usually is we will get a CAT scan to see if the patient's continuing to progress. We don't see any improvement. We've given them the remdesivir. We've thought to give tocilizumab. We've given them tocilizumab. At that point, we will rescan them and we will decide if we are seeing organizing pneumonia type patterns. And at that point, we may restart them on a higher dose again for a very, only for a short period of time, and then quickly de-escalate the steroids. So we're very mindful of this, especially because we're using toci as well sometimes. About this fact of having, having the fungal infections in the background thought process, especially because they're immunocompromised now from the steroid use. They have severe disease. They are in ARDS. So we are sort of mindful of them. I've seen 2 cases where we had to start amphotericin B, but these patients had been on steroids and had been not just on the steroids, but had been in the ICU for a month on a ventilator. So it was not just steroids in this case. Have we started them prophylactically on voriconazole? No, we have not done that. But we are very, we will act on it if we suspect it, but we have not seen mucormycosis as much. We have seen bloodstream infections, fungal bloodstream infections, but I've had maybe 2 cases, and I can tell you I've seen more than a few thousand cases now of COVID in the hospital, because I do hospital and ICU and all of that. So
thank you. So my next quick question is that for how long do we monitor inflammatory markers in patients who are recovering to look for cytokine storm?
Okay, so inflammatory markers, we start off once they get into the hospital. So the ones that we're following are CRP, and we're following ferritin, and we're following D-dimers. And as soon as we start seeing their downtrend, we stop following them. So as long as their clinical course is reflective of their lab work, we stop following them. Does that answer the question?
Yes. And do you give aspirin prophylaxis in patients with comorbidities? Are you using aspirin prophylaxis?
So, fortunately or unfortunately, a lot of our patients are already on aspirin here. Because of their cardiac comorbidities or whatever, what you may have, and so we have a lot of patients that are on aspirin. If you're referring to aspirin for a cardiac purpose, or you're talking about like for anticoagulation?
Anticoagulation. Anticoagulation.
For anticoagulation, we are using Lovenox, essentially, in the hospitals.
Yeah. Right. Okay.
Thank you so much. May I please intervene? We do understand that Dr. Khushboo is on duty right now, and she has to be leaving here also, Samar. So Ajay, if you could kindly look to wrap up.
Just If the doctors will allow me, I'll just take one last question. That is, but I must have the permission of both the doctors. If they have another 2-3 minutes to spare, we can take this question. Otherwise, we'll wind up the show.
I have 10 more minutes.
10 more. And what about Dr. Khushboo? Would you be okay talking for another 2, 3, 4 minutes with us, staying with us? Hello. Dr. Khushboo, can you hear me? I think there's some connectivity issue. So I'll just, as a last question, the very last person, I would invite Sachin Agarwal. He is a COVID warrior. He's been on the forefront of getting help to people. He's seen it all. He's been everywhere, arranging plasma, arranging oxygen, arranging ICU beds and everything. So I'm sure he has something relevant to ask. Sachin, can I invite you over for the last question?
Thank you so much, sir. Thank you so much, sir, for giving me an opportunity. Thank you, Dr. Saab, for sparing your valuable time, first of all. Sir, in the first wave of COVID, the RT-PCR test was considered to be the foremost test. But here in the second wave, they are recommending the HRCT. So people in India, all the people are not that affluent that they can afford an HRCT. Is there some other test or other alternative, or an X-ray can be used as a substitute for the layman or for the person who cannot afford to spend 10,000 rupees on the HRCT? So the first question is this. I have 2-3 questions lined up, please. I won't take much time.
Will it depend on the time? I think this is a good question for some clarity on this, because too many people are rushing to have a HRCT. So I think let's have their call on this. Sachin, let's hear the.
Yeah, let's take one. Yeah, maybe we can just take one at a time. I agree. And Sachin bhai, thank you very much for all of that you're doing on the ground. That honestly, I think that
job, I can vouch for that.
Yeah, and that.
I'm so sorry. I did not mean to fall off like that. My phone
Are you okay
just
to be with us for another 2-3 minutes?
Yeah, I'll be okay for another 2-3 minutes, but I'm unfortunately working in the ICU, so I'll have to get back.
So we're going to wind it up in next 3 minutes maximum. Right.
Yeah, actually, so Kush is a Dr. Khushboo is a pulmonologist. Kush, Sachin bhai asked. He said that the first wave people were focusing on PCR tests, and he said the second wave he's getting a lot of recommendations to get a high resolution CT, but of course this is very expensive. Do you I have my own thoughts, but do you want to just comment about whether everybody who might have COVID needs a CT scan?
Sure. So, that's a great question. I'm glad you asked that. That's also been something that's been, I've heard a lot of different places. You do not need CAT scans. No, you do not need that. What you need is an X-ray, which tells us whether you have a pneumonia or whether you don't have a pneumonia. And that kind of tells us what your course is going to be, whether you're going to, end up progressing or whether you're not going to progress. And that's all you truly need. When we do get CAT scans, or like I was just discussing with the other physician on the forum, is when we have questions about therapy, or if we think that you may have a blood clot, that's when we would engage in a CAT scan. But no, you do not need to have regular CAT scans. It will not, the physicians will be able to read the X-ray and say, yes, you have a pneumonia. And if you have a COVID infection, that is a reason for your pneumonia.
Can I add one thing?
Yeah,
sure.
I 150% agree. I make a point not to get CAT scans on most of my COVID HRCT on most of my patients, unless they have some complications. So of course, if you have a senior doctor or inpatient doctor who's advising it, yes, there will be some cases where it's very valuable, but I don't want to be cynical or something, but this happens. It happens in India. It happens in US, and I don't think anyone is doing it for bad purposes. But those tests are very expensive, and a lot of people make a lot of money off of them. I'm not blaming anybody. I'm just saying that it's the same as with remdesivir on black market or HRCT for everybody. This is not a question of where in higher income countries, in India, in low income. I don't think any people who are seeing COVID regularly feel that HRCT should be standard across the board for diagnosis. It should be reserved for special cases, in my opinion. And I think most of my colleagues in all countries share that opinion. Kush?
Yeah, absolutely. And I think that, HRCT is for very specific disease processes. They're called interstitial lung diseases. I don't think that early on in COVID, or mostly throughout the course of COVID, it has a role. If anything, it's going to be a contrast study for blood clots, or just a regular study to see, hey, is your disease progressive? I mean, have we done everything? So there'll be questions that the physicians will ask themselves, and then they will want one. Absolutely. If you're on-ground physician is requesting it, there's probably a purpose behind it, and you should get it. But it is not a regular use thing. It's not like, I'm going to go get my blood checked. It's not the same thing as getting a CAT scan. So absolutely not, no. And I completely agree with Samar.
Dr. Khushboo, my second question, please.
Sachin,
Sorry
I
for
think we
interrupting
might
you.
need to.
I won't take much time. Dr. Khushboo, like while admitting the patients or seeing the history of the patients, like people are getting complications like heart attack or brain attacks or the nervous attacks. Sir, in the WhatsApp University from the past 2 days, we have been getting messages like a black fungus or like people on oxygen, it is due to the pipeline or something like that. Sir, could you please brief about that? What precautions people need to take after 2 months of getting cured or after 1 month of getting cured from the COVID? For
I'm sorry,
heart attacks or brain attacks.
You're saying that
he's asking about post-COVID. So one to 2 months into recovery, he's heard stories of people with heart attacks or strokes or black fungus, which is the mucor that Dr. Sarab was mentioning. So he's saying, what can people do to protect themselves in the post-COVID period to avoid complications 1 to 2 months out? Am I correct, Sachin Bhai?
Yes. Thank you, sir. Thank you.
Yeah. So, let me put it this way. COVID is a disease and has done things to patients and to organ systems that is not usual. That is not something that is followed by any specific, viral infections prior to this one. Okay, I have had patients who have had, cardiac issues happen. Usually they are early on in the course. When I say early on, I'm not talking about immediately. I'm talking about more in the subacute, meaning 2 to 4 week phase. We are seeing cardiac complications. Neurological complications, yes, we are seeing, early all the way to later on, especially the brain fog part of it. Strokes, again, can happen. So this is changing. COVID we have seen patients who've had heart attacks. We have seen patients who have had, who have had strokes because of it. And infections, obviously, right? Because depending on the therapy course that they had to take. I don't know if there's anything that you can do to prevent that. It is how your body sort of handles this specific disease. In certain patients, it is causing clots and giving them strokes, giving them, heart attacks. In certain patients, it's not doing that. I don't know that there's anything a patient from outside, a person can do to prevent this from happening. Does that make sense?
Yeah. Thank you so much. Sir, Doctor, my last question, sir. Sir, my last question. Hope this will benefit the youth that the youth under 45 years of age that has started vaccinating today onwards. Sir, Manoj Bhai, senior partner, just expired due to this. This question could be of great help for us. So, like
let's have the question fast, Sachin. Let's have the question.
We are running out of time. Please.
People who are having getting themselves vaccinated. Sir, it is said that they can develop fever or some symptom like that in the another 2 or 3 days after getting the vaccine. So, but a few cases have been reported where the person has been affected by COVID, but he's thinking that the fever is that he's developing antibodies or something like that. Sir, is there anything that we can protect the person from, or any such cases that you have also come across? So, because saving a person becomes very difficult when he passes the 1 week of after having fever or the infection, sir.
It's also a good question, and as you said that with so many younger people now younger adults getting vaccinated, it's a question. Sachin Bhai, I don't want to keep saying over and over there's nothing we can do, but in that sense, I will tell you that there are, I think, and Dr. Alok, I think, mentioned this some examples of this earlier, that there are some rare cases where somebody can develop actual COVID after vaccine, but in the millions and millions and tens of millions of vaccine doses that we have given in the world, cases, I think, as far as we know today, are very, very, very rare. So most times that fever and body aches, even Kush has had, I have had after COVID vaccine, those symptoms should improve in 1 to 2 days. If you, the best thing I will say is education. If somebody, be it young person, senior citizen, anyone, if somebody receives COVID vaccine and after 48 hours, they continue to have fevers and symptoms, they should seek medical care because that's not expected. The COVID vaccine side effects are brief. They're generally most times mild. Maybe my symptoms were severe. I was so tired I couldn't get out of bed, but only 1 day. And they're not dangerous. So if you feel lousy, just sick for 1 day, teak. After beyond 1-2 days, if you're feeling worse, something else is going on and you need to speak to a doctor to get some better advice. That's my opinion.
I completely agree with what Samar just said. Same opinion, definitely.
Thank you so much, Dr. Khushboo and Dr. Samar, for your time. May I invite Ajay Goyal, the president of the SJA Alumni Association, for his vote of thanks to our eminent panel for taking our time. We'd planned for a 1-hour discussion. We've gone on to almost 90 minutes.
Yeah, you overshot the time. Thank you, Robinder.
But it means there's value been exchanged.
Thank
Ajay,
you, Robinder. Thank you, Robinder. And I can't thank Dr. Khushboo and Dr. Samar enough, actually, for a very informative, a very enlightening, a very useful session with us and sparing that kind of time. But still, I realize the last word on this has still not been said. As you can see, there are more questions, more people want to know more things. So I think we would request in the same breath both the doctors to be available to us somewhere down the line. Of course, we'll give them a good gap, and maybe we'll share more experience on this so that it for everybody's benefit, if they're okay with it. And on behalf of the SJA Alumni Association, I take this occasion to thank them profusely for their time and sharing their experiences with us. And I also thank all the members who took out time and they were there with us. And some very useful questions came our way. I thank all the doctors who were there on the panel, who also asked very relevant questions. All in all, this session has been a wonderful session, and I thank everybody for that. Thank you very much.
Thank you.
Absolutely, it was a pleasure. It was definitely a pleasure to be here, and we are happy to, at least I am, and I know Samar will echo the same thing. I'm sure we'll be available, and we can figure out how we can arrange for that. Okay,
that'll be wonderful. So we'll hear more of this. So please keep making your notes. Thank you very much. Thank you.
Thank you, guys.
Thank you, sir.
Thank you very much,
so much,
also. Thank you for making this happen.
Thank you, sir.
Thank you.
Bye, sir. Good night, sir.
Bye.
Thank you.
Good night. Thank you. Thank you, Dr. Alu.
Bye.
Bye, Bia.
Bye, sir.
Thank you.
Thank you, Abhinav.
Thank you.